Good morning, everybody. Welcome to the February 13th, 2025 County Commissioners meeting. We'll start the meeting with the Pledge of Allegiance. Mr. Godu, read this off, please, sir.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We'll start we'll start in Zoom land. Pat, you're flying solo in Zoom land. Good morning. In the room we have Commissioner Dew, Commissioner Tombrello, and myself. Also around the room we have Julie Hoyt, Allison Kivakowski, Jason Henry, Chantel Jaconin, Jude Gates, and Layla Matilla. So, I expect more people to stream in. The roads, hopefully everyone was driving safe. The roads were terrible this morning. And so, with that,
I know,
hopefully. Jason, do we need to separate you?
Oh, yeah.
You might have to just make him leave.
Yeah.
Well.
The timeout chair.
Is that admin leave with pay?
No. So as people stream in, we'll make the announcements, but more importantly, we'll move on to the consent agenda. And so, Commissioner Tombrello, do you want to make a motion with respect to the meeting minutes?
Motion to approve the January 16, 2025 public meeting minutes. Because I have a crossover and that's it. I have a crossover, so I'm gonna read what my crossover means.
We're not approving the non-public.
You did, and the January 23rd non-public meeting minutes. Yes.
Yeah, I got it crossed out.
But
Only the public. Only the public.
Oh, okay.
We have the non-public.
Thank you. So
right.
we have the January, for clarification, we have the January 2025 non-public meeting minutes and the January 16th public meeting minutes.
So moves.
Okay.
Perfect. That's
Right.
exactly what I was gonna say.
Second.
Right, I'm sorry. I'm sorry to interrupt you.
I
Okay,
second.
okay, great. And do we have any, anybody have any comment?
But my only comment is that we need to have shorter meetings because I had to read through the January 16th minutes and they were like forever. And you did a great job on them, but it was just like, oh my God, this is still going on.
Yeah.
You know, they were long.
Thank
Thank you. You do a good job on it.
Thank you so much. Okay, thank you for that comment. On the motion, Commissioner Godu,
Yes.
Commissioner Tombrello, and I vote yes. The February 13th, 2025 off-cycle AP list.
Motion to approve the February 13, 2025 accounts payable list of $15,137.90.
Second.
Discussion? Chantel, was just a couple things that needs to be approved for long-term care.
Yes.
Okay, great. Anybody else? Well, no. Okay, on the motion, Commissioner Tombrello,
Yes.
Commissioner Godu,
Yes.
and I vote yes. And now we have our regular payroll approval for February 14th.
Motion to approve the payroll expenses of $1,563,568.12 for the period ending February 8th of 2025.
Second.
Discussion? We're a little higher than normal, but a lot of it is tied to some separation payment, payout, et cetera, for a couple employees. Okay, on the motion, Commissioner Godu,
Yes.
Commissioner Tombrello,
Yes.
and I vote yes. We're moving right on to commissioners' updates. Does anybody have anything this week?
I'll just start. I'm absolutely thrilled and excited to begin our negotiations with the sheriff's deputies this afternoon.
Great.
I have my book ready.
You
And
do.
we're ready to make it happen.
You have your snack pack.
We got snacks, we're all set.
That's great.
I'm the opposite of Steve. I'm not that excited. I start my correction one this afternoon. I'm excited, but I'm not as excited as you.
Okay.
The only other thing I attended NHAC last Friday, nice to see, and there's a group of new commissioners. It was pretty nice to see some new faces that actually showed up, you know. thing about up there, you know, 30 commissioners, 10 are active, 10 are somewhat active, and 10 I've never seen. So it's nice to see a couple of new people. It's just nice to see the whole group. Yeah.
It's good to see you on the new committee too.
Yeah, yeah. And Jason, don't ever, if you ever go up there and you don't attend, you'll find yourself on the committee. Just ask Mr. Henry over there. Yeah, when I found out that I was on the committee, I said, oh, nice. Don't I have a say in it? No, you don't. Yeah. But I got a couple of years to get you back. That's all.
Well, I guess I'll use mine to, again, highlight, Layla's efforts and the group's efforts for the, roses for the residents. So Layla, do you want to, comment on how it went overall? In terms
So pledges and collections reached $720.
Wow.
Number again?
720.
I'll get
And-
bouquets.
That is so awesome. And so what is that? So every resident will have a rose
Oh,
for
yeah, every
Valentine's.
every resident will get a rose, and then the rest will go into the residents' efforts fund.
Man, that's so
So
awesome,
wonderful.
which means that they can use that money for other opportunities or things. So Layla, thank you so much for organizing that. And thank you to everybody across the county that donated. It's like, what a little, it's always amazing how like the cumulative effects of small impacts really make a difference in people's lives. So
The generosity of everyone was just amazing.
it's a nice, it's really nice. All right, moving on, we're up to the Harvey construction warrant, off-cycle AP.
Yeah, I'll make a motion to approve the February 13th, 2025 accounts payable warrant C 250909 payable to Harvey Construction Corporation in the amount of $3,633,721.52 as recommended by the Senior Director of Facilities Planning and IT and the Senior Director of Finance.
Second.
Discussion?
Well, I'll just, I know this is gonna surprise everyone. Harvey Construction sends in, reimbursement expenses, $19,000 worth of reimbursement expenses do not have receipts. I don't like the business practice, and unfortunately, I am not able to support this motion.
I'll just say, when having done that tour, first of all, we're talking small amounts that are not sort of in the receipt portion. But I do want to say, like, I just walking through, I can't believe what a great job they are doing managing this project and the lightning speed with which it's getting done. It just, I can't emphasize enough how blown away I was by taking that tour and seeing how well maintained and well organized and how well constructed that building is. It's just phenomenal.
I would, on this here, for the last 2 years, I've been pretty much active watching the meetings. I know Commissioner Godu has had an issue with this. I mean, I would love someday for us to kind of just get it so that Commissioner Godu could also vote on the warrant. So it's only 19,000. And I did see some of them on the list that didn't have the backup. I mean, is there a way to solve that either through Chuck or through Commissioner Godu going to Chuck and asking for some more back? I know when we signed the contract way back, it was at the discretion of us whether or not we wanted every invoice. But it would be nice if all three of us, if we all support the building and we know we're going to get a building with a key in there, if we could come up with a solution to have Commissioner be able to vote yes on it, I would be thrilled with it. I would like it to be unanimous in the future. So I don't know if the solution is to get Chuck to get you some more stuff so that the 19,000 maybe becomes 1,000. I mean, I know it is a discussion. I remember we said that we didn't need every single invoice, but it would be nice. That's my take. It would be nice for it to be unanimous approval of that pay amount. So that's my take.
Thank you, Tom, and I do appreciate your sentiment on that. I'll just comment that I don't believe that Chuck has the receipts. I believe Harvey has not provided them to us. If Chuck had them, I've had discussions with him a while ago. I'm sure he
We
would,
haven't asked for it.
let me come and take a look. The request needs to go to Harvey to please include you know, like trips to Lowe's that are $2,500, like, but I just want to see a receipt, you know, but
And it is like notable that we're talking on a over $3.5 million warrant. It's I mean, percentage wise, a very small, I know you recognize that as well. And, you know, again, we have GMP for a reason, but we'll move on.
Yep.
Does anybody have anything else? Okay, on the motion, Commissioner Tombrello.
Yes.
Commissioner Godu,
no.
and I vote yes. Human Resources, weather emergency for Sunday, February 9th, 2025.
I make a motion to declare a weather emergency in accordance with personnel policy procedures 8-4, starting at 7 a.m. on the start of the first shift or as defined by the department on Sunday, February 9th, 2025, as recommended by the Senior Director of Human Resources.
Second,
Any discussion?
I think we'll probably have more for next
I
year.
was just gonna say the same thing. More to follow. On the motion, Commissioner Godu,
yes,
Commissioner Tombrello, and I vote yes. Long-term care services, we have the Core Physicians LLC amendment of the Medical Director of Physician Services Agreement.
I make a motion to approve an amendment of Core Physicians LLC Medical Director and the physician, services agreement effective March 24, 2025. And authorize the chair to sign all necessary documents as recommended by the Senior Director of Long-Term Care Services.
second,
Discussion?
Yeah, if I could just
Yeah, sure.
explain kind of in general, because it was a multi-piece. So essentially, we have two different doctor groups, Core and Lamprey, that provide services to our residents. We typically have 5 doctors from those companies. Prior to my starting, one of those doctors had left. So we've been operating with 4, and there was conversations again prior to me around the, because they are splitting that extra load for the on-call in that day evenly. There were conversations about being able to take that amount and split it so that everyone was compensated. It has been a labor of love for the team to figure out what that amount was, how much was due back, et cetera. We have gotten the refund, because I wouldn't pay until we had the
Yeah.
money back, right?
Oh,
With,
great.
with
Because
that,
that was,
We hope.
yes, no, we have the check.
No.
We just have not, cashed it yet because we wanted to wait for all of this, because in order for us to do it, we had to amend the contract, because, which is what this is, because the contract didn't allow us to take that back and disperse it to an alternate contract.
Great.
So this would allow the providers from Lamprey that have been covering that extra day from Core to get 25% each, because the 4 of them split for that cost. So it's not an added cost in that, it's just reimbursing the providers that stepped up to cover that component of it. The other piece of it is at the same time, because the rates were going to be going up, their rate increase goes into effect in April.
which is that 5% increase, correct?
Yes, and then there were random names in there of providers that no longer service us, and a nurse practitioner clause that was removed. And then an additional piece to it was we were paying for consultant hours for the assisted living, in which we weren't utilizing or receiving, and we ended that one.
Great. So with that 5% increase, some of that will be offset by some of the other costs that were in the contract that we weren't utilizing.
Yeah.
The other thing is, I mean, thank you so much for getting that money. You know, obviously it was a little bit sticky dealing with the
Trying to figure it
money
out.
movement, so
Yeah.
thank you for. Great.
last week,
On the,
is it from last?
yeah, on the motion, Commissioner Tombrello,
Yes.
Commissioner Godu,
Yes,
and I vote yes.
Thank you.
Okay, moving on to Point Click Care Mealtime Solutions Subscription Agreement.
I'll make a motion to approve Point Click Care Mealtime Solutions subscription agreement beginning March 1st, 2025 for a one-time fee of $2,730 and monthly fees of $568, and authorize the chair to sign all documents as recommended by the Senior Director of Long-Term Care Services.
second,
Discussion?
Nope.
If I can,
Okay.
I'm just gonna keep going down that road. So, with this, that's the replacement for the nutrition management, but I do wanna just add, as we have started looking at the RFPs for dietary, A few of them mentioned different programs, so the conversation that we had was, although this is the one that we would like to use, some of those proposals are built around a different one. So we are reaching out to see if there's, so some of those, if they're set on that one or that adaptability, but in interest of the RFP, we don't wanna also then submit this and then have to do a different one also. So although this is the route we're going in with 2 of the 5, I'm looking at you, Jason, 2 of the 5, I believe, don't have a preference, but 2 of them spoke to different programs. So we should know by next week either way. So if you're comfortable still signing it now, but I do wanna just be transparent about the fact that it may change if we so chose to go to a different vendor that used a different program.
So perhaps we should table this
Yeah.
at this point and then go and wait and see, because
Okay.
this contract doesn't go into effect till March 1st, so we have a
Correct.
couple weeks to
Yep.
ferret this out.
I wanted to be transparent in that because if we chose someone from the RFP that used a different system, I just wouldn't want to pay for something or have something if
Makes sense.
it went a different way depending on the RFP, and we're still so early in the process that we don't fully know.
Motion to table.
Second,
Okay, on the motion to table, Commissioner Tombrello,
yes.
Commissioner Godu,
Yes.
and I vote yes,
Sorry.
so table. Now we have adult medical daycare request for Silverthorne.
Motion to approve an adult medical day, care request for, dated February 1st, 2025 from Silverthorne for an additional client LD at the amount of $15 per day for 5 days per week, retroactive to November 1st, 2024.
Second.
Discussion?
I guess,
All right, I guess I missed the retroactive
that's what I
part.
think this is.
Um,
You want me to explain? I assumed there'd be questions. So, with Medicaid, when you apply, it can take up to 6 months to a year to get it. So this would just retro back, his Medicaid retro back and covered some of those expenses. So it would just be covering that difference to the date of Medicaid. So had this individual started with the Medicaid, this is the same cost it would have cost us. So it's just paying the difference back to the date of when Medicaid was approved.
Okay, so this is coming out of our regular budget for this. This is not coming out of the grant,
Correct.
Right,
and we
have. plenty of
we're in
money
good
and
shape. We were
there, yeah.
right on, so, yeah,
Oh,
okay, I'm good with
So say
it.
it's $70 Medicaid, roughly, we'll be paying the 55, and then we would
It's
just.
the
use
co-payment
Right.
essentially that is being covered, and so for the time when the Medicaid went back, it's just covering the co-pay that we would have been paying if Medicaid hadn't been approved quicker.
I love to see that somebody's in adult medical daycare from November all the way up to, that's a good sign, that means it's working and
Yeah.
they're
Yep.
going there, so I like it, because you guys.
And I believe, and I'm not under, but I believe his family had been covering that difference in the interim to get them in, so this would just cover what would have been paid anyway.
Fantastic.
Yep.
Okay, on the motion, Commissioner Godu,
Yes,
Commissioner Tombrello,
Yes.
and I vote yes.
Thank you.
We're already up to department head updates. Woo-hoo. Pat, do you want to lead us off?
Not really much to report. We're, plugging away here, just doing our jobs and busy, but that's really it. So I don't want to take up too much time. Hope everybody is staying warm and drive safe today.
Thank you, Pat. We'll start this way. Jude, are you ready?
Good morning. Jude Gates, Senior Director of Facilities Planning and IT. The weather's keeping us busy up and down. We are dealing with some plumbing issues in the nursing home. Hopefully getting on top of it pretty quickly. We're also working toward planning an emergency drill for next week associated with some of the rooftop replacement that we're doing. So that'll be just noticed the monkey on top of the clock.
So that's the monkey from Christmas that was brought in, and people on my team move the
Move it.
location every week to
It
see if
What
there
is
was
that,
no
elf on
risk.
the shelf?
It was so funny. Last week it was in the plant.
Yeah,
Furniture.
they just didn't know where it came from, so it's been a joke. I was like, well, I can tell you where it came from, and now it just still gets moved.
It's great.
It's adorable.
Jason,
Yeah.
Jason wants to do elf on the shelf year long. My grandson loves it when it comes to that Christmas time, it's elf on the
There's
shelf.
a whole line of accessories for those elves.
Yeah,
Yeah.
I move it to crazy places and we go looking for it, he is so excited.
Well, this is something new. We need
Yeah.
monkey accessories.
There
That'll be the next.
No, thank you.
Sorry, Jude. Thank
No,
you.
not at all. It distracted me. We've been working with DOC, gathering some information for them while they've had their, pre-inspection via ICE. I'm sure Jason will report on that, how well it's going. As far as the new building goes, the emergency generators were delivered yesterday. I think I let the crew there know that.
Love it.
Switchgear isn't in yet, but they'll be able to do startup. We need to register the oil tank. I'm reviewing the permit now to make sure everything's in place for that. So that's
Dude, How
exciting.
big was that generator? Is that 225 or?
I don't even know off the top. There's two of them.
Really, yeah.
Yeah. So the ground level is completely covered, DOC and the Sharps Department, and then there's less coverage in the office areas, but yeah, they're big.
Yeah.
It's exciting. I watched them coming with the crane
Cool.
yesterday.
Oh, so cool.
Yeah, those are the kind of things, like when you get near the end, they're figuring out all the data plugs are in the right place for where the furniture is going, because the furnishing's been ordered, looking at the artwork, planning the historical display out front, like there's just lots of stuff coming together at once. It's exciting stuff. Working on budget, I'm meeting with Allison tomorrow, and all is well. Thank you.
Great. Thank you, Jude. Chantel.
Good morning. Our census on the nursing home is 134. Our assisted living census is 48. We have no residents or staff with COVID. And as long as we continue, we will clear the outbreak on the 17th, which is what will take us out of masks at this point.
Great.
Just some general items as a interdisciplinary team. We started the process yesterday, looking at the 5 RFPs for dietary. So working through those pieces, we have that kind of set up meetings to continue. Budgeting's underway for us. We are kind of just formalizing or finishing for some of those write-offs that were compiled in the beginning to be able to bring them forward. So you will see those soon. And then my excitement, I guess, my positive is last week we had done a test run for the virtual dementia to get a timing. And this orientation group was the first orientation group that we actually embedded it into our orientation. So before our staff's even hitting the floor, they'll kind of be able to go through it, be exposed to it. And then we'll be able to staff that were missed to kind of pull if they're here those days. And I had the pleasure of talking to them at the end of the day during my session, and it was such wonderful dialogue that came from an eye-opening in how to change our practices and how we deal with our residents. So, you know, that alone is a win, and we'll only continue to support our residents and the care that they get. So that has started.
Really
That
nice.
is
Can I ask a couple of questions? I'm interested in the contract for the food services. How many RFPs did we
5.
get?
5 of the 7 submitted RFPs.
Okay, so we have 5. And at first glance, or maybe this should be offline, I would like to take a glance at what's been proposed and how different they might be.
They're
if that's-
very different, and I think that's one of the things that we had initial conversations, Jason, myself, Kendra, kind of as the assisted living, Elaine has done a lot of work around some of it. And then Chuck came as well, so there's definitely a lot of intricacies. There's a lot of questions, so yesterday, happy to share them. Yesterday's meeting, we kind of just formulated questions in regards to things to send out to the vendors to have back for our meeting next week. And then our plan that we talked about was, as we kind of narrowed it down, we were gonna reach out to Layla to have the kind of top people, the top 2 or so, to present for you to be able to hear and ask questions as well. In
Great.
addition to, we talked about bringing Tim from Meals on Wheels to the table during that as needed, if possible as well.
So,
But my concern is that this RFP is very different from the last RFP because we've really nailed down the specifics that we need. I'm concerned that everybody follows that, and I'm also concerned at the additional potential cost that we may be incurring because of all these extra requirements that we'd like. So I just want to make sure we have time to look at it and review and digest.
So
they-
question, the RFPs range from about 20 pages to about 200 pages each. Are you interested in all of them, or we also have, Elaine was kind enough to kind of build the performas that have the financial pieces specifically in one sheet.
I would be interested in the one sheet for the moment, and then, and then we can dig in later if we need to.
Well, and
Good.
I was gonna say, just, part of the stuff is just, you know, the team that we have, that's what we're doing, digging in page by page by page of the 50 RFP and taking account and how much it's costing, and that's the stuff that we're doing, compiling all together for you guys and trying to come up with the top two that met those criteria as possible with, you know, with the cost and those kinds of things, but that's.
And also looking, not to pay off, but also looking at it whole picture in, you know, some people coming to the table don't have corrections experience, and that's a huge component of it. So we truly are sitting with all of the binders in front of us. We've read them, kind of marked them up, asking questions. You know, something I read versus the way that Jason interpreted it was slightly different, and we compiled a list of questions. I think we were in here for 2 hours, and then we stayed a little longer for some of the other pieces around, this is great, but who's paying for it? Like some of those pieces, and we compiled long lists of questions to be sent out to the vendors this week, so that when we meet next week, we can have those clarifications and continue the discussions. So what we're currently doing is just flushing out
The issues.
all of those to try and make it as apples to apples.
Which is gonna be difficult in this case.
Which is
Yep.
why I think
Yes.
if you guys are doing all that footwork, I think presenting to us the top two with those meetings, for me is I feel the utmost confidence in you guys in sort of distilling it to the top two, and then us having a round table meeting with them to sort of ask questions or as we
Really
make,
good is everybody at the table, because like you said, we had different perspectives
yeah,
looking at this, because maybe not all of them are being 100% what I'm looking for, or to, we're looking at globally. You know, so it's gotta be, work for all sides of all sides, and they're way better than what we have for, don't get me wrong, all of them put in for it is way better than we've had here, so there's accountability and those kinds of things, so it's gonna be beneficial to the county, it's just a matter of it wholly working for all of us.
And
That's what
Chuck's
we're
at the
doing.
table too.
so.
I have total faith in your ability to go through all of that and I just want to make sure that we have enough time, once you've done all the hard work, for us to really make some good decisions and because we'll have new questions.
Yeah, and
probably.
I think kind of our conversations around that was a lot of looking at full picture for benefits of the county, but also it is the largest contract and it is a big decision in kind of those pieces, which is where it kind of narrowed down to who meets what's needed, cost kind of those pieces, and then have it as a presentation where we were gonna be reaching out to Leila to kind of coordinate where you would be able to, the vendors are gonna be presenting, so instead of having 5 people present, kind of narrowing down to the top 2, and then that way there's the ability to ask additional questions. And we would have already pre-summarized some of the highlights and the why, from our perspective, so that it was from a time standpoint, you were getting all of the information without spending hours page by page.
Yeah,
I think the RFP actually lead, you know, if you looked at the RFP, you knew that some of them would be all over the place. The
Yeah.
RFP was I looked at it and I'm like, that one can't do that, this one does that. I mean, the RFP puts them all into different areas, so it's a lot of work. you
And
know.
it's really interesting because there's some beautiful ideas of even forward thinking in there and ways to streamline things and ways to bring additional value to everyone as we continue to evolve as a county to really continue to set the trends and,
be leaders.
you know, be that too. But we are taking into account the cost in those pieces as well.
So I think, I mean, is everybody in agreement from this end of like getting the top 2 to come in or do? Yeah,
Well, maybe 3. I don't know. I'm,
You'll know
this is so
something.
different and so complicated. I'm hoping to see that one sheet. Maybe that will help.
I-
2 or 3 is
Okay.
where my
I
head's
think
at.
that probably in another week or 2, they'll
They'll
have
have
a
done
better
more.
sense of whether, I mean, I think maybe the direction is if number 3 is close to
Put 'em on the-
2, put them in, but if it's kind of a divide, if the top 2 are clearly the top 2 in your mind, then we'll just take.
And
Does
if
that
you're,
make sense?
if you're okay even waiting too, because there were
Mhm.
discrepancies even in some of the numbers. So some of our follow-up questions is some of the numbers in those sheets aren't tallying. correctly, so we have additional questions or there's random asterisks that says like, but it doesn't include this. So, but that's part of the number. So some of our questions truly are around just the numbers. To have an accurate rate, where if you look at it now, I hope you have a calculator. Because it is a lot of math and trying to kind of add them out and see, well, if this isn't included, how does that work? That's technically in it. As well as some of the items and who's paying for some of those things, because that would inflate the number as well. So a lot of our questions were around the financials on that to make it so that we were truly having clear representation of what the actual cost is. All inclusive.
Great. Okay,
Sounds like you're doing a great job
thank you. Thank you for all your hard
so
work.
far.
You know, we've scheduled 2 hours, 2 to 3 hours,
Please.
2 to 3 hours every week we've scheduled.
Yeah,
Really.
and we've had them on the calendar for,
Yeah,
Yeah,
and we
really.
may, and as, you know, time comes up, we may have to actually squeeze in some more meetings to get this done and get it all accurate, so
And
we can compare
technically,
apples to apples.
we have to have the contract for all of them from an implementation date. I think it's in April in order to get the lead time and everything done for the July start date. So anticipating that and the scope of it is why we wanted to meet proactively, already build it into our schedule so that as we had questions and pivoted, we were truly devoting the time to have that without it impacting any implementation date.
Thank
Thank you so much for working together too, I mean, I know it's
We
like.
do it surprisingly well.
All right, Jason.
She's like my little sister, keeps me on task.
With that transition. HR nightmare.
It's okay. I feel the same, like I think brother.
I still heart you.
Well, that's for tomorrow.
I'm doing it all week.
Okay.
I'm trying to send, well, plus it's also negotiation, so I was trying to spread some.
Oh, there we go.
Oh.
Okay,
I get it.
Allison, that's supposed to be safe for non-public. And just-
Oh my goodness.
That was great.
Sized.
Boy. So in-house, today's 135.
Wait. This is our goal.
My
Invert-
goal has been to beat
Invert
you.
the,
I'm off by one.
the population at the jail with the long-term care and we're one away.
Well, 135 in-house, 67 on between pretrial and adult.
Those don't count.
Adult services, and another 15 in other facilities that are mine as well too.
Okay, well then I want to count all my labor and.
Okay, stay focused.
Working on budget, still working on prime care to extend the contract for a year, because don't know what's gonna happen with the new building, but we're gonna wait a full year. I need to, again, manage to see what we need in there, so we need to do an extension. We're, prime care is working with, the DEA and board of medicine and everything else. We're trying to do with our methadone is take homes. So with methadone, because we are an OTP, opioid treatment program, we can do methadone inside the jail. The hard part is like some of the females we have, which we have to keep because they're on methadone. If I send them to another facility, in order for them to do methadone, they actually have to take them into the community every single day. And actually it costs more, even just medicine wise. You know, like $19 compared to our 11 cents. And bring an officer out to the community every single day. And then eventually if they get stabilized enough that methadone clinic might give them a take home for that jail. So nobody wants to take inmates on methadone from us. That makes it very difficult. So what we're trying to do with the new facility is working with them and having that be a site that they can take home, which is patient specific medication for them, which means they package them up at our place. We seal them up, lock them up, bring them over to there. And that will be way easier than trying to do a whole OTP and safe, all this other kind of stuff. With that, so I'm trying to make it work, and since they're still our patients or up to our own OTP at the other facilities, that maybe we allow us to become the distributor of that medication for take homes. So we could send it up to the other facilities where these people are, and then we could not have some of the methadone ones that are here. Then we have access to better programs, other things for that kind of stuff. So that's working now. We'll see how it goes. They seem to be amenable to it a little bit, but it's just more hoops to jump through. And
It's gonna be really make a difference in programming for women
Yes,
at the end of the day and be a huge cost savings.
yes.
Because we're paying, you know, when you send it out, it's like $20 a day a person, a delta of 18 and change.
Yeah, that's why we keep
And
hearing it.
manpower.
They're not, you know, they're not on the best unit that I would
Right.
consider. We're doing the best we can for them, but it's not.
Programming.
It's not ideal. We have a better situation we could do if we did that. Comfort Dog be on site all day tomorrow. He is with the trainer close to being finished, so we'll have him soon on site, but so tomorrow's doing training all day in the jail. We got an ask from DCYF. They want to hold hearings and they're looking for, they need 3 rooms at a time, all the Wi-Fi capability with a bunch of stuff. So basically we're back saying it's not gonna happen in the jail. We'd be the first county jail they wanted to do it in and.
Are these
Said you can't do it.
hearings for incarcerated individuals who have family court matters
We'll have family matters under for the Sonoma Center,
for the,
the payouts.
oh,
And they
okay.
want 3 rooms with judges and this and that and everything else, all Wi-Fi, laptops with something.
Yeah.
We can't, there's not a jail that can accommodate, so I don't know how they're gonna do it, and they don't have any other place to even to do this yet. So they don't know what they're going
Right.
to do. But I have, my department rep back say, we can't do it, any questions, they can call me, because it's not something we can accommodate.
That's a huge, like, we don't have
I don't have
the
infrastructure.
infrastructure, yeah.
Bandwidth,
Yeah.
all that kind of good stuff. Excuse me, words. And then yesterday we had, our pre-ice audit yesterday and day before. Usually they bring in 4, people from an outside company. It's not ICE that does this, they contract with a private company. It's Nakatomi, something or other company. They usually have 4 people and do 3 days. They had 3 people and, you know, only give them 2 days. So they could have worked very hard. There's a lot of standards, ICE, but, so they do a preliminary. Couple things I can tell you is they were very happy with staff. They said most places they go into, people are really not nice to them. And, that's one, and people always make excuses when you find things. They found our staff doesn't do that, and that they were very eager to make these changes, which I've said all along for staff, you know, it's nice to have somebody else come in and look. So we had things to look at, deficiencies they found, a lot of it is our policies, a lot of it, some of it we're already doing in practice, we just need to put it in policy. Some of it we just got to cut and paste their stuff into our policy. Some things are like how we store some of our chemicals, some of it is, some preliminary things, overall wasn't really anything that major, we'll work on. And they'll do the report to ICE. And ICE, will get back to us. It's still a process, because at some point then we gotta talk with ICE about contract, what it would look like, what are they looking for, what are we looking for? It's all negotiation. We plan on going down to Plymouth, Mass. They have an ICE, a facility down there, they have 500 ICE inmates inside of it, and they're the gold standard. So we'll go down there and see them, and obviously some of the forms and other things that we need, we won't reinvent the wheel, take from them, we'll take from Stratford County, we'll look at other places, so. Overall, it was very good, they were very happy, they were very, very impressed yesterday, they said it was a breath of fresh air that, you know. I guess they think, and so, warm reception, I guess, but it went well,
Great.
and I'll keep you in the loop as it's going, I'm not sure. ICE will reach out for us and start talking to them. So I got.
Allison?
Hi, Allison Kivakowski, Senior Director of Human Resources. Definitely, we're in a weather pattern over these next couple of weeks. We're watching a storm coming in Saturday to Sunday for potential weather emergency declarations. We've had a little bit of a delay with Oc Health, the contract for X-rays with Derry Imaging. They're opening their new facility over in Dover, which has kind of pushed back the recommendations that Primex made. You know, that it's on review on their side. But of course, timing is everything, and we do need to have an X-ray done for a potential onboarding. So we're trying to see if we can work something out, some way, a workaround to get it, or it'll delay a little bit till we can get that contract signed, because they cannot bill to us. Any facility can't bill to us because we don't have a contract in place for services. So we don't want it to go against somebody's insurance. It would be hard to pay for that. And so we're just working that out. I just wanted to let you know that. We have some really great webinars, not, I mean, actually sessions, training sessions coming up. Colonial Life is for our accident insurance. It's voluntary. Accident, hospital, critical illness and cancer. That benefit can be, somebody can enroll in any of those options anytime. It's not just at open enrollment. So that's going to be happening on Thursday, the 20th. We had a lot of input or a lot of questions from folks about other kinds of opportunities for financials, not just the New Hampshire retirement system. So we have two of our 457B providers nationwide in Empower. They're coming on, Empower is coming on site on March 4th for a lunch and learn. And then they'll have an informational table outside the Water Tower Cafe on March 18th. Nationwide is totally virtual because they have their account reps all over the country. So that'll be a link and we will have it set up in the Hilton Auditorium for anybody that's in-house that wants to attend, and those that can't, they can go virtual. And we are going to have from Gallagher, we're going to have a Medicare seminar. It's related to employees that are going to hit the threshold of 64 going into 65. As
What if you're after that?
yeah.
You beat me to it.
It's
What do I do now?
for those people that have to make a decision on Medicare A, it's an automatic enrollment. But there is an interplay with our high deductible plans. If you high deductible plans and contributions, there's limitations. You can waive, and there's been a lot of confusion that you can waive your enrollment and defer it into Medicare and not have any penalties when you're ready to retire. So we're having them come on site. Actually, they're going to do a virtual on site, and it's also going to be recorded. And we sent them over some questions, and we have had a lot of people stepping up to the plate saying they wanted to partake in that. This will have some implication on whether we're supposed to sunset the OAP 10 plan. That's been something that's been out there for about 6 years. And last year we agreed that we would sunset that. But we're gonna kind of determine maybe that might not be a good idea right yet. We'll have further discussion on it because we have a number of people right now that are on the high deductible plan. And we have no way of knowing if they have enrolled in Medicare A. It just means they cannot contribute to that if they have. County can't contribute to that, and then they as employees can't contribute self-contributing. So we're going to kind of let this webinar go through and the seminar, and then kind of hopefully folks will reach out to us to tell us if they've enrolled in Medicare A, so we can then have a further indication of any impact that might have and have discussions with the board about that 10% OAP plan. I am having a meeting with Gallagher. It's our pharmacy and all of our plans trending. We have that usually right before I have them come up to the board. So they're gonna let us know how we're trending, and that will be taking place, I think, if it's not next week, it's the following week. And we'll have that, and then I probably will have them come in just so that they can kind of start talking to you about, here's where you are, here's how you're trending, any ideas they may have. They might talk about the high deductible plan again, the OAP 10 plan. But I just want to get that out there as quickly as possible because it was brought up by an employee related to Medicare. So they had some questions. So we want to make sure we're fully informed. And, Wednesday, it's the 19th. Thanks, Julie.
Oh, great.
So thank you. And that's all I have for today.
Thank you, Allison.
Thank you.
Julie, do you have anything?
I do not. I'm here for support.
Hey, mission accomplished.
Thank you.
Layla?
I just want to mention one thing. Monday is a holiday. So agenda submission deadline is tomorrow at 2 for next week's meeting.
Oh,
Thank you.
I know. Do some bribes.
All right, that concludes department head updates, new business, old business. Anybody?
None for me.
none for me.
I'll just plug February 24th, the legislative conference again.
None.
There's still plenty of
Sign up.
tickets, so there, if you have to sign up or any of your departments, or anybody else, please, it's gonna be a good event.
Great. All right, we have public comment, but the snow has deterred everyone from appearing via Zoom or otherwise. And so with that, I'll take a motion to enter into non-public.
I'll make a motion to go into non-public and New Hampshire RSA 91-8:3, Roman numeral 2. Looks like we're doing personnel A and J internal processes.
Second.
On the motion, Commissioner Tombrello,
Yes.
Commissioner Godu,
Yes.
and I vote yes. So we are in non-public. All right, actually, I don't think we made a formal motion to come out of non-public. So we will make a motion. Can I move to exit non-public?
Second.
On the motion, Commissioner Godu,
Yes.
Commissioner Tombrello,
Yes.
and I vote yes. All right, we are out of non-public and we had two non-public sessions and I'll turn it over to Commissioner Tombrello to make motions with respect to those non-public sessions.
I'll make a motion to seal the two non-public minutes for a period of, I'm actually gonna put a letter, well, period of indefinitely because it was determined that the divulgence of the information likely would affect, number one, affect the diversity, reputation of any person other than a member of the board.
Second.
Any discussion? Okay, on the motion, Commissioner Tombrello.
Yes.
Commissioner Godu,
Yes.
and I vote yes. And we'll take that last motion.
Make a motion to adjourn.
Second.
All those in favor?
Aye.
Aye, we are adjourned. Happy Valentine's Day,
Yeah,
everybody.
yeah, girls do.